The highest honor awarded by the South Carolina Athletic Trainers Association is the Fred W. Hoover Award of Excellence. This award honors members that have given unselfishly to the association and its membership for many years.
Hey everyone, my name is Erin Bryant, and today I have the pleasure of interviewing Elaine Baker, the Fred Hoover Award winner. Elaine, would you like to introduce yourself?
Certainly. Thanks, Erin. First of all, I appreciate the opportunity to visit with you this morning. As she said, I'm Elaine Baker. I have been an athletic trainer for 39 years, in regard with including my GA years. Been a certified AT since 1984. Currently, I'm at Furman University, and I have been here for 36 years. Extremely enjoyable atmosphere and opportunity here at Furman. I serve as the Associate Athletic Director for Sports Medicine, which places me as the Athletic Administrator for Athletics here at the university. I am also the Director of Outpatient Rehab for our Therapy Center. That is a part of our Sports Medicine department and is affiliated with one of our local hospital systems. My degree, I started at Winthrop College, and my degree was a Bachelor of Science in Health and Physical Education. This is where the athletic training major was positioned in those days. And then I received my master's degree with an emphasis in health and exercise science from Furman University.
Nice. Thank you so much, Elaine. Can you kind of touch on how you got to where you are, the position that you're in today?
Well, I began and did really my grad assistant work here at Furman University, and then left and had the opportunity to be the head athletic trainer at a small junior college in our area at North Greenville College. And at the time, the university's men's athletic and women's athletic were actually run separately, separate entities. Now you have to remember this was in the early 80s. And so one of my good colleagues and friends, who was also a grad assistant at the time, he had gone to another university at Liberty as the head athletic trainer. So our mentor, who was the head athletic trainer at the time, had moved up into administration and became the associate athletic director. And he asked Bruce and I to come back, and we wanted to bring the sports medicine piece under one roof, whether it were male or female. And so Bruce called and said, Elaine, I need you to come down and help me put this back together. So that was in 85, and I haven't left. And had the great opportunity to really move up in position and responsibility. I started as an assistant athletic trainer. And then what we did here at Furman is we started looking at the opportunity to have a therapy component and a reimbursement revenue model in our sports medicine department. So we actually opened the Sports Medicine Center in 1992. And we took care of the campus for their rehab services. Bruce Getz at that time was the director, and after a couple of years, he moved on in with a private firm, and I had the opportunity to take over. So in 1995, I took over, and within a few months, we opened to the public, and we're now one of the strongest rehab facilities here in the greater Greenville area. So I've had the opportunity to move up in administration and still clinically be involved with patient care and student athlete care. I think I've had the best of both worlds because I had the opportunity to work in a traditional setting for 15 to 20 years. And then I've had the opportunity to work in a clinical setting for the last 15 to 20 years, and I never had to leave. Yeah. So when people say, well, Elaine, you've been there a long time, I'm like, yes, but I've had different roles and different opportunities. And I still get real excited every morning to get up and come to work. And really the most satisfying, I tell you, I've taken care of athletes all my career, but when we opened the clinic and I had an opportunity to start taking care of folks on campus, people from the community, and you realize that getting them better is just as important as getting the starting quarterback and the starting point guard, because this is their livelihood and this is their quality of life. So it just really took it to another level of what an athletic trainer can bring to the community and to patient care.
Yes. Yeah, I agree with you. I think that we don't need to just focus on athletes. We can help the greater population as well. So I really like that. Can you talk about any challenges you had during like that transition from like a GA position into like the role you're in?
Well, I never saw things as challenges as I was coming up. And to give you a sense, Aaron, the time demands that I know are a real focus right now with a lot of young professionals, that there were time demands, but we always looked at it as this is what the job entails. So we just did it. I was often the only woman in the room. When I came through, Aaron, there were only two of us in Division I athletic, only two females, myself and Melissa Martin, who was at University of South Carolina, was a good friend of mine. So we were in meetings and, the state conferences, and you look around and it's just she and I.
Yeah.
So was that a challenge? I just really never looked at it like that. It was like, here we are, woman, hear me roar. I mean, we're going. So, I was very fortunate. The male mentors and colleagues around me, there were never barriers put up in front of me. So, I was very fortunate. To give you an example, when I was at the junior college level, I was the only certified athletic trainer in the entire conference at that level. So I would go to away games and things would happen with the visiting team. I would just go out and help. So it's a different world, world. And there wasn't requirements to have ATCs even at the small college, and there definitely was not a requirement in our high schools. So we have come a long, long way. For women, we have come a long, long way. When I go to scatter meetings now and I look around and, really the females are the majority, it's exciting. It warms my heart because I came into a very male dominated profession.
Right. Can you talk about any of your best memories or experiences that you've had as an athletic trainer that still stand out to you today?
I tell you, in 39 years, there's a lot of memories and they all kind of blend. I think and I can't even say one thing, memories, I am seeing student athletes now who I saw their mothers and fathers when they were athletes here.
Yeah.
And so, they come in and go, hey, Elaine, mom and dad, you took care of them and they still talk about you, and hopefully positive. No, they still talk about you and they know you're going to take care of me. And, that just gives me a lot of, joy and satisfaction to see things come, full circle. Of course, a memory is me receiving the Fred Hoover Excellence Award and being inducted into the Hall of Fame as the first female, and right now the only female. Our state association, we got to do better. I was extremely honored and humbled to have my friends and family in the room that night. So that always, is one of my most fond memories.
Yeah. So you've kind of already touched on this, but as you have mentioned, like you've seen different like generations, like the mom, and then you've seen the kid of the parents. Can you talk about like how athletic training has evolved over the years?
Well, I think athletic training, we've become really more diverse in our practice settings, in the way we approach treatment and therapies. I think you've got so many alternative therapies out there that, practitioners can choose from. One thing that I do see, and I hope the pendulum swings back the other way, is a lot of the young professionals that are coming out, or I think there's too much emphasis on some of these alternate therapies for their continuing ed, and we're losing the basics and the foundation of functional movement patterns and how you analyze a student athlete's issues, get to the problem, and then resolve it. I think those therapies have a lot of place, but I would like to see our young professionals coming out have a more balanced approach to their treatment philosophies. And in all you kind of see the pendulum go back and forth. I've got it, there was one thing that comes to mind, and it still makes me kind of chuckle. I'm sitting in a SCADA meeting and they're going over a new use of a modality that's integrated into manual therapy. And I happen to have 3 former grad students in the audience, and they turn around and look at me and go, Elaine, didn't you teach us that about 10 years ago? And I said, well, everything that it was old is now new again.
Yeah.
So, everything's just in cycles.
How would you envision the next steps of athletic training in the years to come?
Well, I think, I like how the professional preparation, I've always been a proponent for many, many years. Friends of mine, as the master's level, we went to a more postgraduate requirement. Many of my colleagues were like, Elaine, you've been yelling about this for 10 years. I said, well, yes. But I think what's important is where that preparation that we need to have a more robust practical component to our preparation. The days, the internships, which I came through, back in the dark ages, but then we went through the curriculum, and I think we've now come full circle. But I really feel like as we move into that entry-level master's program for your certification, there's also got to be a residency piece to that, because what I'm seeing as a director and as an employer, the young people coming out aren't ready to actually step into the job. And I think that's just a result of not having enough practical real world hours. I think, the fully immersion, all of that's fantastic. You guys coming out now have so much more didactic background and clinical book knowledge, research, than we did. But we want to kind of not lose the hands-on because we are healthcare.
Right.
The other piece that I would really like to see more, and this may be, more generational, is more of a communication preparation in the training for our athletic trainers. Is something similar we went through with our physicians about a decade ago. Is we had brilliant practitioners coming out, but these young physicians could not communicate well to their patients. And I think that's very crucial in athletic training, where you need to be able to communicate with your student athlete, and more so with the parent.
Yeah.
It's very important. Our young people, the parenting now is very helicopter, very involved with the young people. So you can't dismiss the parent. You've got to have them on your team, and the communication is key. And I think that's just something that I would like to see formally in some nature added into our preparation for our young professionals. I think that's where we've got a little bit of a deficiency right now.
Yeah. I do agree with you. I think that the residency part of athletic training is going to be more up and coming in the next few years. I think that would be like a key component to athletic training, especially like us as master's students, entry level. I think it would be very important to have that piece. So I'm glad you touched on that.
Well, good. Well, and that's something here at Furman University, when we had a very strong grad assistant program for a number of years. And then the university had just kind of moved more into undergrad research. And so we unfortunately lost that program. But we have since added a fellowship program to kind of take the place of it. And so that's where that residency piece, we push here a very strong another year. And I've seen it be very beneficial, to these professionals going out.
Gotcha. How did you first get involved in volunteering for the profession?
Well, and back, I did not have an opportunity really to do volunteer internships or anything like that when I was coming through. I really, you know, I did my internship hours, and that was the exposure I had. I was a college athlete, so we had athletic trainers at Winthrop at the time, and that's where my interest spiked. I enjoyed the athletic side. I was very interested in the healthcare side. So Joe Kinney, who's also a longtime member of our association, he actually was the head athletic trainer at Winthrop at the time. And then Ray Parlier was here at Furman. So all of those, folks that had been with the state for many, many years. But when I volunteered, I was already in my internship.
Gotcha. Can you kind of touch on how being like an athlete like may have interfered with you becoming an athletic trainer? Because I feel like some of our athletes now feel like they can't join the profession because of time that it takes to become like an athletic trainer, like clinical hours and of such.
Well, and to be honest, I was a college athlete and I did nothing mine was a kind of a different path, Aaron, where I really did not do any of the athletic training as an undergrad. Everything I did was in grad school. So when I went through grad school, I basically was working full-time hours as part of an internship kind of at a grad level. So it's kind of funny now because everybody, was student trainers as undergrads and that really wasn't my path. And most of mine was in grad school. So it's almost like I was ahead of my time because that's kind of how we do it now.
Yeah.
I did all the coursework and then I did the internship in grad school.
Okay, that's kind of funny.
Yeah.
Can you touch on how you made balance between family and career? I know you mentioned earlier that that you kind of knew the requirements of the job and kind of just like went with it. Can you kind of touch on how you balance the family and career aspect?
Okay. Well, and as I mentioned, I do not have any children of my own, but I have a very close knit family here in Greenville with parents and grandparents and brothers and that type thing. And what I enjoyed was they were always kind of fans for Furman University. So, mom and grandparents were in the stands when I'm covering football. They're in the stands when I was covering volleyball or at the women. They never missed a women's basketball game at home. So my family was a part of what I did and was very supportive of what I did. But, depending on, well, back then, my coverage, I would work football, also volleyball, and then go on the road with women's basketball, and then come back and go on the road with softball. So I would just change the apparel that was in my suitcase to meet whatever the season was. So it was not uncommon for me to be at football practice, and then volleyball would start that afternoon, and I would run in the back of the gym and we would do volleyball, and that would be about an hour and a half. They didn't go that long. And then I'd run back out and finish up with football, which would go another few hours.
Yeah.
It's what we did. And, there were holidays that I missed. You got on a bus with the women's basketball team on Thanksgiving night. You had Christmas, and then Christmas Day, you were getting on the bus to go to a tournament. And it's what we did. So, those holidays and things, yeah, I missed, some things, but I was very fortunate because my family was very involved with being a Furman Paladin fan.
Yeah.
So they were there with me a lot. So I think, we had that balance.
Yeah. Can you talk about your involvement with the South Carolina Athletic Training Association and how you
Okay.
became involved with that association?
Okay. Well, and as I mentioned, when SCATA first began, there were probably maybe 15 of us in a hotel room, dreaming of the vision of the South Carolina Athletic Trainers Association. And I laughed because some of the hotels that we would meet in, you guys would probably we'd be scared to go to those places now. So when I walk into the big convention center now and look at everything and where we've evolved, it's just amazing. I have been on numerous committees, because back in kind of the day, there were only a handful of us, so we had to do everything.
Yeah.
But I was on the Honors and Awards Committee, the Program Committee for several years, one of the third-party reimbursement committee for about 15 years when we were working through reimbursement and our certification licensure. I've been a presenter, so anything, I've just had an opportunity to just be very involved, and really had been asked over the years to be an officer or run for office, but the timing never was good in regard to what my responsibilities here were at the university. And this being my primary responsibility, and I knew how much time it took to be secretary treasurer and then move to vice, that type thing.
Right.
So that's the only area that I never did get into.
Gotcha. Can you kind of touch on the importance of being involved with organizations at the state level or even national level?
Oh yes, I think as a young professional coming, and that's one thing that I really push my staff to be involved in various areas, because one, I think if we want to take responsibility for our profession, we have to be engaged and involved to continue to move us forward. The other is, I think the network of being an athletic trainer is tremendous. The friendships, the colleagues, we're a great group of professionals. And I think, you don't want to be isolated. I work with physical therapists every day, and really they do not have the type of close-knit organization that we are blessed with in the state of South Carolina as athletic trainers. And all of that evolved from those early years when all of us were sitting around, myself and Fred and Andy and Bruce, and all of us sitting around trying to envision where we wanted our organization to go. And the state of South Carolina, we have one of the strongest athletic training associations in the country, probably one of the strongest in our region. So I think it's just tremendously important that you want your voice to be heard. And one thing that's exciting for me in SCADA is we really have representation across all settings. It's not just the collegiate section or just the high school. We've got industrial, military, clinic. It's just exciting to see where we are.
How do you think that the organization will evolve over the next few years?
Well, and I know we're kind of in the midst of some of that right now. I think it's terribly important that as a profession, that where we are positioned under the available regulatory bodies in our state, I think is key. Personally, and I've been very vocal on this, is I feel like we need to be moved over under LLR because I think that's very reflective of the level of education preparation and professional preparation that our profession demands. I also, because I have been in the clinical third-party payer environment for over 20 years and dealt with lots and lots of insurance companies and managed care plans, the nuances of certification versus license does make a difference with some of these folks. And where we're positioned, I think it gives us even more credibility when we are trying to really solidify our reimbursement position in the billing environment.
Do you think we will, as a profession, will lean more towards billing in the years to come?
I'm sorry, Erin, I lost you.
Can you hear me now?
I can.
Okay. In the future, do you think our profession will lean more towards the billing aspect?
I really don't. And this is why. I don't, because we are such a integral part of healthcare in athletic environments. And in those environments, the billing component is really not the model. You're a salaried employee of that institution. I think, but there's we need to be able in a private setting to really be a revenue generating provider, which here at Furman, we created a comprehensive sports medicine model and a therapy component. I see patients, my services are billed to payers. I mean, we've done that since the early 90s.
Yeah.
So when I go to meetings and I go, well, we got to get third-party reimbursement, I'm like, we've had it.
Yeah.
Since the late 80s, early 90s, so you just have to continue, with new insurance plans and things, just, to make sure that we're recognized as providers and, we've got the codes and all of that's in place.
Yeah.
I just feel like I guess our birth and our still majority of our work settings are in professional, collegiate, and high school athletics.
Mm-hmm. Okay, so to wrap up the interview, I have one more question. What advice would you give today's young professionals who are about to enter the athletic training profession?
I think if you are looking for a profession that can give you so much satisfaction and internal joy, athletic training is a wonderful profession to choose. But you do not need to enter our profession if you are not a service-minded individual. This is not a profession for self-glory and self-recognition. It is a very respectful, honorable profession where young people depend on you, older people depend on you, but it is not a me-centered profession. And you are going to be solely disappointed and frustrated if that's your mentality and you enter this profession.
Yeah, I agree. I do want to thank you so much for taking the time to interview with me today, and congratulations on your award.
Thank you, Erin. I appreciate the opportunity to chat with you. And hey, as a young athletic trainer, I'm truly excited for you and the future you have ahead of you.
Thank you so much, Elaine.
All right. Take care.